levels of lipids or fats in the blood. It's a major risk factor for heart disease and stroke, so that is why we're talking about it today. Dr. Quinn, he's going to share with us what we need to know about this potential health risk. So Dr. Quinn, what actually causes this problem?
You know, it is so ironic. Literally 2 minutes ago, right before I came on today, I had a conversation with a young lady, and she was so concerned about her lab results. She wanted me to go through every single result, which is understandable. And I told her, I said, it's my job. I said, it's not only my job, but it's my pleasure. We went through everything. Her blood glucose was less than 100, meaning that she had no concern of diabetes. Her kidneys, her liver, everything was perfect, except one thing. It was her LDL. And you might ask, what is LDL, right? Low density lipoprotein level. Ideally, you want it to be less than 100. Hers was like 142, which is a little bit elevated, but her overall cholesterol was 198. You want that to be less than 100. This is what's called a lipid panel. It includes the total cholesterol, the bad cholesterol, which is the LDL, and the HDL, which is the high density lipoprotein or the good cholesterol. You want to watch those numbers and have that discussion with your medical provider. And if those numbers are elevated, it means that you have a higher incidence or probability of cardiovascular disease, to include strokes or heart attacks down the road. But this is a very important screening and discussion for you to have with your primary care provider.
Absolutely, and we all want to know what can be done to help a person with this problem.
Well, this problem is something called multifactorial, meaning that multiple factors can contribute. One of the most important factors is your family history. That's why it's so important that you know your family history and have that discussion with your medical provider. If you have a family history that's high for cardiovascular disease and specifically elevated cholesterol, then you have a higher probability of having that same problem. Another factor that contributes is your lifestyle. If you eat healthy and exercise, you have less of a chance of having these problems, even if you have the genetic predisposition. But this is something that you can control.
Gotta have everything in moderation.
Moderation.
Yeah. Thank you so much, Dr. Quinn. We're running out of time, but appreciate your time as always.
Hey,
It's
thank
certainly
you for having me.
12:14.